I was just going to start by speaking a little bit about the charity because I'm sure that all of you know because that's how you found here. But just to give you some information that we're a small charity in the UK providing information and support for people about pregnancy-related pelvic girdle pain. So we aim to spread awareness and promote accurate information about PGP to enable people to find treatment. And the charity is run by lived experience volunteers. So like everyone who can see here. I hope that you find the session informative and useful, just to highlight that some of the material addresses physical and emotional challenges of living with long-lasting PGP. So please take care of yourself throughout the session. If you want to step away and take a break, just do that. I'm hoping that bits of this will be recorded, so the informational content we can share later. We're not medical professionals, so the information shared is intended for general informational purposes, not to be taken as a medical advice. So always consult your own healthcare providers about your own circumstances and diagnosis and treatment. So just a bit about the format for today. We have 3 speakers. So we're going to have 3 short discussions about PGP. Sarah will talk about PGP, some bits about the anatomy of the pelvis, about some myths. Claire's going to talk a little bit about longer lasting PGP and the types of questions and some common questions that we see in our support groups and some advice around those. And then Mel will speak a bit about mental health impacts of chronic pain and moving forward. And there's a little exercise that she'll do on there. So just quickly to introduce myself, I'm Vicky. I'm the coordinator at the Pelvic Partnership and have been just for about a year. But my experience of PGP was since 2021 in my first pregnancy, around 20 weeks. Since then, I've had another baby in 2024. And I still experience pain now, mostly in the sacroiliac joint at the back. And like quite often when I'm sitting, as opposed to doing anything else. But I've been through various stages of like thinking I'm doing really well and then doing too much and then not doing so well and then so on and so forth. But I have had physio over the last, I guess, 5 years now, on and off from a private physio, which has been the thing that's helped me the most. And now the main thing for me is building up strength. So I think I'm going to go to Mel next, then Claire, and then Sarah can move on to your talk. So can you introduce yourself, Mel, please?
Yeah. So hi, I'm Mel. I have a daughter who's 4 years old, and I had PGP from being 7 months pregnant to when, and I didn't actually know I had pelvic girdle pain. I didn't know what it was. I didn't start getting treatment or really fully know what it was until I was 3 months postpartum. And I've had treatment on and off since, but I would say I became more or less pain-free from 8 months pregnant when I finished my 8 months postpartum when I finished my first set of treatment. But I've had flare-ups and treatment since, and similar to Vic, I have pain down the bottom of my back in the sacroiliac joint. Things that have worked for me have been chiropractic care. So I had an amazing chiropractor called Sally, and gentle exercise, eating less inflammatory foods. I've done a lot of mindset work and weight management, which is a bit of a yo-yo situation. I think it's quite difficult to manage yourself, that kind of thing when experiencing pain. I have more pain-free days than I ever have had, but I still experience quite a bit of pain. I've had to adjust my life quite a bit to accommodate that.
Okay, shall I go next? I am Claire Wilding. I've got 2 children who are now 13 and 10, and I had severe PGP in my first pregnancy. And I wasn't offered any treatment at that time. I was told, oh, don't worry, it'll go away when the baby's born. And of course it didn't. And about 6 months postpartum, I was told, unfortunately, there's nothing more we can do for you. This is unfortunately going to be your situation from now on. Fortunately, I got in touch with the charity and found somebody who was able to treat me. So it was probably about a year postpartum that I started having that treatment. And I would say that I made a full recovery, really. I went on to have another baby as well, and I had PGP again, but less severe. And I'd say I've made more or less a full recovery now, though there are still things I need to be a bit careful about. So yeah, that's my story. And I've been involved with the charity for about 9 years. And one of the things I do is work on our Facebook support group, which some of you may have seen.
Thank you very much. So I'll introduce myself. I'm Sarah Fishburn, and I have 3 children. My eldest is 28, and I have she's 27 actually, and a 24-year-old and a 22-year-old. And I had PGP in my first pregnancy, and like Claire, I was just fobbed off and told, oh, don't worry, it'll get better as soon as you've had the baby. And then after I'd had the baby, oh, give it 6 weeks, 6 months, a year. And then at a year, my GP said, oh, well, maybe you're just going to be one of those people who doesn't get better. And I'd seen about 5 different NHS physios over the course of the year, and they'd all told me to do more exercise, less exercise, lose weight, take antidepressants, all those kind of things. They told me it was all in my head. I was just unfit, all those kind of things. I'm sure they're very familiar stories to everybody here. And a light bulb went on when my GP said, oh, maybe you're just one of those people who doesn't get better. Because I thought, you clearly have no idea what this is, because a year ago you were telling me it's going to go as soon as I'd had the baby. And then I met Fiona, who's another of the committee members and trustees, and she'd heard about this rugby physio who was treating women with PGP. And so I went to see one of his colleagues, who looked at me and said, oh, well, it's just a mechanical problem. It's just your sacroiliac joint's not doing what it's meant to do. Treated it, and I walked out instantly feeling better. So sort of a little while later, Fiona and I set up the Pelvic Partnership, and it's grown since then. And our goal really is to support women, make sure that they get accurate information, so that they're not just fobbed off and told it's all the hormones, nothing can be done, that kind of thing, and that they really understand what the challenges are and find different ways of making a recovery. So I had physio, which got me back on my feet after that first baby, so that from about 14 months, I had much less pain. My goal was to have more babies, because I really didn't want just one baby. And so she worked with me towards that, treating me all the way through my second and third pregnancies, which got progressively easier. But I'd had some, because I'd been not treated for such a long time, I had some joint damage, which this isn't going to shift, but I'm pain-free, and I've had quite a lot of treatment along the way, but sort of in phases. And at one point I had some prolotherapy injections as well, just to kind of stabilize things. So I can really do everything I want to do now. But it took time, it took a bit of perseverance, but it was well worth it in the end. So one of the things I was going to talk about, or where I was going to start, was to talk about the pelvis, because I'm sure lots of you will have heard all the myths about it's all your hormones, and so you can't do anything about it, there's nothing you can change. But actually the up-to-date research, which has been around a really long time, actually, I say up to date, it's been around a long time, it shows that actually it's much more to do with asymmetry of the pelvis and how it's moving. So I have a pelvis here. So this is what your pelvis looks like. So it's a ring of bone, and your baby and your pelvic organs all sit in the middle. At the front, you've got the symphysis pubis, and it's got, if I hold it there, you probably see it a bit better. It's got this fibrous disc in between the two joints, and that's held together by lots of ligaments, which cross over the joint inside and outside the pelvis. And then at the back, you've got the sacrum, which is this triangular bone here. And the holes in it are where the nerves all pass through to supply all the muscles and so on, and into your legs. And then you've got these really chunky joints at the back. I'll turn it around and show you from that side. So they're really chunky, pretty stable joints normally. But during pregnancy, there are hormones flying around, and your joints do move just slightly more. And sometimes you might step out of the shower funny, or you might just slip and jar it, or you might have an underlying problem or pelvis problem that just means that your pelvis is not, your joints are either a bit stuck, so that, again, there are loads and loads of ligaments going across these joints. So they might either be a bit stuck or just slightly rotated or just not sitting in quite the right position. And so if one of your sacroiliac joints at the back gets stuck, like I say, it's really stable. It's held together very firmly by all these ligaments going across it. And so if one of them's stuck, then the other joints, so the symphysis pubis and the other sacroiliac joint, which all move just a tiny little bit normally, they have to move more. And because the symphysis is smaller, less stable joint, that's why it often hurts first. So if you're having treatment and somebody only looks at the painful bit, they're probably missing the point, because this is a bony ring and it all interacts with the rest of the pelvis and with your lumbar spine as well, which is these bones here are your lumbar spine, and your hips join in there, so that everything is connected. They're all inextricably joined. So if you're going for treatment, what you're looking for is somebody who will have a look at that ring, and they'll look at your joints and often start at your sacroiliac joints just to make sure which one it is that's causing the problem. Work out why it's stuck, whether it's rotated, what it's doing. And then with manual therapy, they'll gently mobilize it or sometimes gently manipulate it so that it starts moving normally and symmetrically. And that restores the normal movement within that bony ring. So that's sort of the bony bit of it. The other bit of your pelvis is your pelvic floor, which sits at the bottom here. So it attaches to your symphysis pubis at the front, so here, and then to your sacrum at the back. So sometimes you can end up, particularly if you've had something like an episiotomy or a tear during a previous birth, you can end up with a really tight pelvic floor, which just holds on. And traditional pelvic floor exercises where you're asked to sort of tighten and release and tighten and sort of hold and tight over, make your pelvic muscles make your pelvic floor muscles work really hard. That can increase that tightness around any scar tissue or anything. So that can often be the missing link. So you sort out the mechanics of the joints, you sort out any tight muscles that might have built up, particularly if you've had PGP for a while. And then sometimes the missing link is this pelvic floor issue. And Claire's going to talk a bit more about treatment a bit later on. So I hope that gives you a sort of idea of how the pelvis works. And so if you've had PGP for a while, and it depends what treatment you've had, how effective it's been, and how it's affected all the other muscles and how it affects your body as a whole. And also, if you've had pain for a long time, that has an impact on your mental health as well, because being in pain is really significant to how you feel, and not being able to walk or not being able to sleep has a massive impact on your mental health. So the two are really inextricably linked. So there's a mechanical element, but there's also the impact that it has on you psychologically as well. So just talking about how to find treatment, as I tried, you try the NHS first because it's free, and there are some really good NHS physios around the country, but they can be quite hard to find. So it's definitely worth trying, and you're not necessarily looking for a women's health physio, because sometimes they're really good at the kind of pelvic floor stuff, or if you've got continence issues, that kind of thing. But if you've got a joint problem, they may not have done the extra training to understand just how the pelvis works. They may not feel entirely confident treating you during pregnancy, that kind of thing. So often a sports injury physio is somebody who is used to rehabilitation. So they're often used to, like my physio was a rugby physio. So she was used to rehabilitating men who'd mashed up their pelvises on a rugby field and needed to get back into full fitness. So she wasn't going to get me just to the point where I could walk just about. She really wanted to get me back to full fitness and so on. So it was a combination of damping down the pain, sorting out how my pelvis worked, and then starting on a strengthening. And I was pretty deconditioned by then. I was pretty unfit. I wouldn't say I'm super fit now, but that's my choice because I'm not as energetic as I should be or could be. But it was sort of a combination of those, and just exercise on its own just did nothing. Because if you've got a lot of pain, it inhibits the muscles from working, so it stops the muscles around a joint from working. So unless you actually sort out that underlying problem, that it doesn't matter how much exercise you do, it's not going to get past that problem, and it's not going to sort out the pain. So I think the other thing I just wanted to touch on was how long lasting PGP is, because I think Vicky mentioned it can be sort of 6 months. So it depends on your perspective. And I think I just wanted to share a case study of somebody who contacted the helpline a few years ago. And she was in her mid-70s, and she'd had PGP since she'd had her son when she was in her mid-30s. So she'd had it for about 40 years. And she'd just been fobbed off and kind of coped, and just always had a bad back and always had a bit of pain, and just put up with it because the GP fobbed her off. And it suddenly got worse and worse and worse. And she'd read an article about PGP, had an article in a paper, and she rang and she said the GP had put her on morphine because she was in so much pain. She was vomiting with the pain. It was really awful for her, but she'd never had any treatment. And so we found an osteopath actually who was near where she lived, and she went to see him a couple of times, and it was absolutely transformative. And she wrote to me a few weeks later and said she'd seen this osteopath, he'd got her back on her feet, and she'd actually been horse riding, which is something she'd been wanting to do for years and years. So she'd gone from being completely incapacitated to that just because she found the right person. So I think that my plea would be, if you have had lots of treatment and it's not getting anywhere, it may just be because you've not met the right person yet. And it's worth having another try, worth exploring other options. Anyway, I've rambled on a lot, so I'm going to pass over to Claire for some more about treatment.
Thank you, Sarah. Before I start, actually, I was just going to mention our list of recommended practitioners because it's been mentioned in the chat. So I just thought it's worth explaining that we have this list of physiotherapists, osteopaths and chiropractors around the UK, and also a few in Ireland and Northern Ireland. And these are people who've been recommended by at least 2 women who've contacted us, who've had sort of moderate or severe PGP, and they've recommended these people as having, helped them recover. So if you're not sure where to go to find someone who can help you, that's what that list is for. And it's ed therapists can go on there free of charge. We do ask them to make a donation, but they don't have to. So it's not like a commercial list, if you know what I mean. It is purely a list of people that have been recommended. So when we talk about recommended practitioners, that's what we're talking about basically, is that list, which can be found on our website. And I think someone's put it in the chat as well. So thanks for that. Okay, so I'm going to talk a little bit about some of the common issues we see on the Facebook support group and some of the treatments and therapy options that are available if you've got longer lasting PGP. So the first thing I'd say is that if you've had PGP for some time, the first thing we would suggest is that you try manual therapy with at least 2 different practitioners, ideally from our recommended practitioner list. And the reason we say that is because, as Sarah was saying, different practitioners will have different approaches and different techniques. And what works really well for one person might not work for another. So it is worth trying more than one practitioner and giving it a really good go. Going a few times. If you're recommended exercises, having a go at the exercises, assuming you're able to and it's not causing you pain, too much pain. We're also very aware that for many people, probably for most people, the cost of getting therapy can be prohibitive. It can stop people from getting therapy, and that's one of the biggest issues that we hear from people who are contacting us. There is a charity we're aware of called the Frederick Andrew Convalescent Trust, or FACT, who can give grant aid if you're trying to recover from PGP and you're struggling to afford treatment. They can pay for physiotherapy. They won't pay for chiropractic or osteopaths at the moment, but we have heard from 1 or 2 people who successfully managed to get funding through that charity. So if you're in that situation, look them up or get in touch with us, and we can help you contact them and see if you would be eligible for a grant from them. So moving on to the sort of common issues we see on the support group. The first one would be what we call sort of boom and bust in recovery. So what that's talking about is that as your sort of PGP is perhaps settling down a bit, or maybe you're having some treatment and you start to feel a little bit better, often what people do is sort of rush out and suddenly do a lot more activity. And often people with PGP have often got young children to look after, so there's a lot of pressure on you to be running around playgrounds or going back to work. So it's really easy when you do feel better to suddenly do too much, and then I'm sure we've all been there. You have a big setback, you feel a lot worse, and it can be really, really demotivating, and you can feel like, oh, I'm never going to get better. I thought I was getting better and now I'm not. I've gone right back to where I started. So to try and avoid this kind of pattern, what we suggest is that you aim for quite a gradual increase in activity. And if you were an athlete, often, you're advised, if you're trying to build up your distance, as a runner or a swimmer or something, to try to increase by 10% at most each session. So we recommend that you think about using the same approach when you're recovering from PGP. So what that means is that if you went for a 5-minute walk yesterday and you felt okay, then today you go for a 5.5-minute walk, and tomorrow a 6-minute walk. And that level of sort of progress can feel really slow and really frustrating. But by sort of trying to change your mindset more towards that slow kind of recovery, it can help you avoid those setbacks. Because I think what most of us do is we do a 5-minute walk and we feel okay. So the next day we go for an hour and then we feel really bad. So, if you can try to pace yourself and avoid overdoing it, that can really help. Another thing we'd suggest is keeping a diary where you record what activities you've done and the level of pain you've had each day. And that can help you in 2 ways. First, it might help you to notice any particular patterns or any activities that are making your PGP worse. But also, when you are having a particularly bad day or a bad flare-up, it can also help you sort of psychologically if you're able to look back and realise that it's not actually always as bad as it is today. That can help you to stay motivated and not feel despairing, which I think is half the challenge when you're living with long-term pain condition, is that you can fall into that despair and feel like there's nothing that you can do to get better. Another thing we would suggest is trying to identify what the activities are that could be aggravating your PGP. Because particularly when you've got a baby or a toddler, there's a lot of physical things you're having to do every day, which might possibly be getting in the way of your recovery. So one of the big ones I think many of us do is carrying a baby or a toddler on one hip. And most people tend to always do it on the same side each time. So what that means is that you're kind of regularly every day, you're putting this big heavy weight, as they get bigger, heavier and heavier weight on one hip, you're kind of twisting your body and putting an uneven strain on your pelvis. So if things are quite sort of unstable, and you haven't got much strength in those muscles, that could be enough to sort of put you out and undo the good work that you're doing. So I know it's really hard to avoid some of these sorts of activities, but even if you could just alternate between different hips, that you're kind of building up both sides equally, that could help a little bit. Another one is the push chair. If you're pushing a push chair, particularly if you've laden it lots of bags and heavy items and you're going up hills, walking long distances, that's not necessarily going to be the best for PGP because of the position your body's in when you're pushing the push chair. And in particular, we wouldn't suggest using a buggy board if you've got PGP, because that position where you're leaning over a toddler who's standing behind your pushchair is not great for you if you've got any problems with your back or with your pelvis. Again, I know it's really difficult because it's so convenient to use a buggy board, but if you can avoid it, you may find that helps. Another thing to think about is your sitting position. So both at work, if you have an office job, often your employer will encourage you to do one of those desk assessments to make sure you're sitting as well as you possibly can. So it's definitely worth having a look at that. And also thinking about the way you're sitting at home. So for example, if you're sitting on the sofa in the evening and you're tending to curl up your feet on one side and it's always the same side, over time you're kind of straining your pelvis in one direction. So that might also be contributing to you not getting better as quickly as you might like. So I'd like to say a few words on different therapies now that you might not have thought about before. So, and these are, I guess, like I said before, these are really for people who already tried sort of standard manual therapy with at least 2 people from our recommended list. The first one is internal manual therapy. Sarah mentioned before when she showed us the pelvis about how the pelvic floor can actually be a big cause of PGP that isn't getting better. And it can be, often because your pelvic floor is very tight. And so the way to get that assessed and treated would be to see a women's health physiotherapist. And what they would do is to place their fingers carefully inside your vagina so they can feel the pelvic floor muscle. And also if there is a problem there, to give you some treatment. And that can feel really sort of quite daunting or scary if it's something you've not done before, especially perhaps if you've had a traumatic birth or something like that. But we'd really encourage you, if you're thinking that that might be something that would help you, but you're not sure, people at the charity would be really happy to talk to you about that. And we certainly got a number of people who we know who've really benefited from having that type of internal manual therapy. Another treatment that Sarah mentioned already is prolotherapy. And that works by basically having an injection into close to the joints of your pelvis. And the idea is to tighten up the ligaments if your problems are being caused by some sort of looseness in the ligaments. And that it's not a treatment that's kind of suitable for everyone. The people who are most likely to benefit from that would be if you're someone who finds that you respond well to manual therapy. So you go and have your treatment and you feel better, you're more mobile, your pain's reduced. But then over the next sort of days or weeks, you find that you lose it and it goes back again. So what prolotherapy can do is to try to kind of keep, tighten up the ligaments to keep that alignment. And so if you're having it, it's important to have it alongside manual therapy. And finally, I'd like to talk about steroid injections. A steroid injection is a short-term treatment, really, and it can deal with inflammation and pain in the joints around the area. And again, this is something which needs to be done alongside manual therapy, because the feedback we hear on steroid injections often is that people feel great for the first couple of weeks, but then the effect just wears off. So in order to sort of get a long-lasting benefit from it, you would need to do it alongside manual therapy, because it may be that once you have that injection and your pain level goes down, you're then able to do perhaps more exercises and get that strength back to support your pelvic joints, so that once the injection wears off, the benefit remains. But yeah, that is one, I think, steroid injections where the feedback we hear is a little bit more mixed, just because it isn't permanent. And also it's not something you can keep doing over and over again, because there are some sort of health risks if you have it too frequently. Okay, so I think that covers everything that I was going to go over. So I'll hand on to Melanie, I think, next.
Thank you, Claire. Yes, hi everyone. So as Vic mentioned, as you're processing all the information that you've just received from Sarah and Claire, we felt it was important to acknowledge the impact that pelvic girdle pain can have on your mental health. So as Vic mentioned, we're going to do a really short reflection exercise. On the screen now, you'll see it's a quote it's been made from a number of different CBT psychologists, such as repeated thoughts, whether positive or negative, can become beliefs over time, and those beliefs can influence how we feel and what we do. Now, this isn't to disregard feelings or what the current reality is for you, and this exercise is by no means a cure. But living with chronic pain and changes in physical capacity can shift how you see yourself, can see your body, your abilities and your mindset. And it might be that you've already adapted your life to sit comfortably within these limitations, and that you have received, or you're receiving treatment, and that you found activities that still bring you joy. The poll at the beginning was very widespread in terms of how long the people on the call today have had pelvic girdle pain. Some of you had it for a very long time. But it might also be that there are some physical activities or aspects of your day-to-day life that have changed in ways that you weren't expecting, and it simply isn't possible to change them right now. And that can understandably have a negative impact on your mental health. There is a statistic that suggests that 49% of people who suffer with chronic pain report suffering with depression. So it's really important to think about it. So this short reflection exercise focuses on life before PGP, the difference that you've experienced with long-term PGP and the impact that that can have on mental health. So the purpose of the exercise is to reflect on what's changed and what your expectations versus reality currently are, to recognise how this has affected you and acknowledge the emotional impact on you. Maybe to gently reevaluate what is possible for you right now at the moment, and then to begin to gently reframe a message that you might hold about yourself and your body and how you speak to yourself. So if you are finding joy in activities, when you answer these questions, it would be lovely to hear the types of things that you do. And if you are a practitioner, perhaps you could take this exercise with you to support your clients, as whilst you are holding their feelings and beliefs and they are 100% valid, helping them to see progress and reassure them of a less infinite and potentially overwhelming belief could be really beneficial for them. One of the examples is my own example of something I used to say quite a lot. It's something I firmly believed after having severe PGP for quite some time, which was I just can't walk anymore, because I used to love walking. It used to bring me a lot of joy, and that made me feel sad and frustrated and depressed, amongst many other things. But that impacted how I behaved. So I avoided activities, I avoided seeing people as well. It made me quite insular and avoid other people. A lot of my friends had babies at the time as well. So there was a lot of comparison going on there about what I should be able to do, which obviously had quite a negative impact on my mental health. But once I'd kind of realised a few years in, so like I say, my daughter's 4 years old now, that I was still telling myself that I can't walk, but actually what had changed for me was that I can walk, but I can only walk short distances at the moment. And I started to tell myself that instead, just to try and help myself feel more positive and be kinder to myself, and not give myself such an infinite belief, which might not be possible for some people. And it's really important to acknowledge that as well. Like I said, a lot of you have suffered for a long time. But I think that acceptance of this being a now and not a forever was quite useful for me. It felt kinder, and it did increase the activity that I did, the paced activity that Claire was just talking about there. And it increased my, I saw more people, I did more things, which helped my mental health vastly as well. So our minds are powerful things, aren't they? And words hold meaning, and what we tell ourselves can impact how we feel. So even the slightest shift in language can impact and help your shift in mindset and self-perception.
We've talked quite a bit about the resources like in passing there, but please go and have a look at the website. Lots of them are on there. If you look at the bits about living with PGP, I think you should be able to find resources that we've mentioned in there. As we've kind of talked about, we have a Facebook group and a Facebook support group. I guess a lot of you have seen us through the support group, but it's a closed group moderated by peer supporters, and it's quite active, so lots of people reply to things on there. There's quite a lot of information on our Instagram as well, which has got some clips about discussions with some practitioners like osteopaths, chiropractors, physios that have quite a lot of questions that might be useful. If you look, that they're in the highlights. You can phone the helpline, the numbers on here, and this QR code is for the list of practitioners, which was shared before. The QR code on the right takes you to our website, just to say that all of the information and support that we provide is for free from our volunteers. So if you found this event useful or any of our other resources, then please consider making a donation. And I know that some of you did when you signed up for the webinar, so we're really grateful for that as well.
So thank you for those of you who are still here and stuck with us. Sorry we've overrun a bit, but I think there were quite a lot of questions, and hopefully we've managed to cover lots of those. And do get in touch if there's anything else we can help with. We're really happy to hear from you. And our aim really is to get information out there and help people to find a way forward, and not just put up with it, because that's not a great position to be in.